It's a growing problem in Minnesota and across the country. The Centers for Disease Control say between 14 and 16,000 people die every year as a result of their addiction to prescription painkillers. Those addictions often lead to heroin use. Here in Minnesota, 342 people have died from heroin overdoses since 2000. But now, medical researchers think they found a new way to help break the addiction. It's by using medical marijuana.
So people often die from opiates, and opiates are highly addictive, and those are two characteristics that cannabis does not have as a medicine.
Dr. Kyle Kingsley is the CEO of Minnesota Medical Solutions, one of the two manufacturers of medical marijuana in Minnesota. He believes medical cannabis can help people who've become addicted to prescription painkillers like oxycodone, morphine, and hydromorphone, as well as heroin.
People think it's swapping out one for the other, and it's swapping out a much lesser evil for something that is killing 16,000 people a year. So, people are not dying from THC or marijuana overdoses.
In Minnesota, medical marijuana can only be sold as a pill, liquid, or oil. Beginning this August, people with chronic pain will be able to get a prescription if they're certified by their doctors. Many of those folks are already taking prescription painkillers.
There's mounting evidence out there that cannabis in the setting of chronic pain helps people reduce their opiate use. And there's also some analyses out there that show a dramatic reduction in the number of opiate overdose deaths in states that have medical marijuana.
This summer, Dr. Kingsley's company will begin an observational study with a minimum of 100 patients.
We don't have any great way to get people off opioids easily.
Dr. Charles Resnikoff treats addiction patients at HCMC.
This cannabis program is an experimental trial. And I think people need to keep that in mind. This is an experiment. This is not a proven therapy. If it works, that would be great. But we don't know if it'll work or not.
The latest number from the Department of Health shows that there are now 1,190 registered patients who are using medical marijuana. And the number of healthcare providers who are certifying patients' conditions has risen to 527.